something that I think all people with Parkinson's and caregivers should know is that swallowing problems or dysphagia is common with Parkinson's. And the symptoms or red flags for dysphagia are coughing and throat clearing when you eat or drink. And so when you start to notice that happening several times a week or even at every single meal, it is important to tell the doctor and to get a referral to speech therapy to evaluate that swallowing problem and recommend the best kind of exercises to strengthen those muscles. You would get a referral from your doctor, come to see a speech therapist for the first time, and knowing a diagnosis of Parkinson's, we would want to take a look at the major things that we know it can affect in my scope. So I'm looking at your voice, your speech, your swallowing, and your cognition. And then based on what we feel that you may need, that's where our goals come from. So if caregivers are present during the evaluation, they're there for the education of our findings. They're there for education on Parkinson's, how that affects their speech, voice, cognition, and swallowing. And then also they're part of that goal development. So, what things are you seeing at home? What do you want to see for your loved one? And they're involved in that plan. Usually it looks like working on things in therapy, and then if they bring issues that are happening at home, we would address that and then give them homework to do as well and try to integrate, when you leave here, what are you taking away to apply to your real life?